how can we support parents to be, apart from also parents, of course, caring parents, also be some kind of co-therapists at home. Because when you come to a psychologist or a doctor, you make a plan of how should we attack your OCD, in what way can we do it the best way. But the arena for this fight is actually mostly at home, where the symptoms are. So you have to be involved in that, and you have to also support parents in that they have to step back from getting involved.
Welcome to All Aboard, where we help parents navigate the ADHD journey. Whether you're at the beginning of this journey asking what now, or you've trodden this path for a while and are wondering what's next, All Aboard ADHD is here for you. We will bring you key information from expert interviews, inspiring special guest stories, and parents sharing their real-life lived experience to help you feel less alone. I'm Claire Quigley-Ward, and today we're talking about OCD in children and its overlap with ADHD. My guest is Professor Per Hove Thomsen, a child and adolescent psychiatrist and one of the world's leading experts on obsessive-compulsive disorder in young people. Per has spent decades researching and treating OCD in children and adolescents. He has led some of the largest international studies into its treatment, helping us better understand how intrusive thoughts and compulsive behaviours develop, how they affect family life, and what effective treatment looks like. In this episode, we explore what OCD actually is, the early signs parents should be aware of, how intrusive thoughts can present in children, why ADHD and OCD sometimes occur together, and what parents can do if they begin to recognise some of these patterns at home. Welcome aboard, Per.
Thank you very much. Thank you for your invitation and the nice introduction. Thank you.
Thank you for joining us. So I'm really excited about this episode because it's not something that I know a huge amount about myself, but I can certainly recognise how some of those traits, particularly around intrusive thoughts, can start to present in children with OCD. So I thought we could begin by exploring OCD itself before we delve into the sort of co-occurring nature of it with ADHD. And that term OCD gets used quite casually, doesn't it? We often hear people saying things like, oh, they're a little bit OCD. But for families who are living with it, the reality is that it can be quite a distressing condition. So what actually is obsessive-compulsive disorder?
Well, you're quite right that OCD is used in common conversation, that you're, as you say, a bit OCD-like and so. And actually, when I started my interest in OCD and research in OCD back in the 1980s, late 80s, it was almost unknown by everybody. The term OCD was not in people's mind, not even the clinicians. So due to increased awareness and that we know much more about OCD, it has become part of the, so to speak, common language. But OCD is much more and quite different from just being perfectionistic or, things that has to be done in a certain way, etc. OCD is disturbing and annoying. I think that we also as adults have some rituals almost every day, or magic thinking that we have to do certain things in order to prevent something terrible to happen. And we all know that this is just silly thoughts, and it's not something that when we look upon it rationally, that we have to do. But just to be sure, to make sure that something will not happen, we do it. Also, when we see a shooting star on the sky, it brings you luck. I don't know about UK, but in Denmark, the black cat crossing the road can cause some disaster. So you have to spit over your right shoulder in order to avoid that. So we have a lot of magical thinking, and it's also part of most children's development that they have during certain phases of their development. They have different things that could look very ritualistic, that we have to read the same book every night for our child. It has to be that brushing your teeth has to be done in a certain way or in a certain order, etc. So, but that's not OCD. It's just part of normal development that you have to build up good patterns for your life. But OCD is quite different, and in OCD, you have obsessions, that's the O, which are thoughts, pictures, ideas that repeatedly enter your mind. And this condition can be seen in children, adults, adolescents, and adults, and there are no differences in the expression. And the thoughts that you have as obsessions are mostly very embarrassing and disturbing, and the children will, at least in the beginning, try to repress them, but with no luck. It's very important also to stress that these thoughts that are some children says that they have sticky brain, so they have a glue on the brain, so the thoughts cannot they cannot get rid of their thoughts. But they know that their thoughts are exaggerated, that they are absurd, maybe bizarre, and not rational. So they know with their rational part of their cognition and the brain that this is actually too much, but they are compelled to react upon the thoughts because they otherwise they'll get very anxious. They will have a panic attack if they cannot perform the rituals. So they know it's their own thoughts. It's not that, like you see, for instance, in schizophrenia or psychosis. It's not that anybody else had implanted the thoughts in your mind. It's your own thoughts, but you cannot get rid of them, and they are on repeat again and again. So that's the O in the OCD, and the C are the compulsions that you have to do in order to avoid that something terrible will happen, or in order to make the anxiety go away. And they are very often linked to one another, the obsessions and compulsions. And I think we'll get back to the content that we see of the thoughts. So that's OCD, and it's very time consuming. According to the diagnostic criteria, they have to occupy many hours per day, which is often seen. Some of the children I've seen have been suffering from those thoughts and rituals throughout all hours during the day. So OCD is very disturbing and causes a lot of impairment.
That's so interesting. Really, really interesting. In fact, that actually the obsession and the compulsion element of it are so linked. And from what you're saying, my understanding there is that children, adolescents, adults have these thoughts. They know they're their own thoughts. Rationally, They know that maybe they make no sense or they're illogical, but they are so strong and so overpowering and so almost sounds like controlling when you talked about the amount of time that it takes up in their day, in their lives, that those then compulsive behaviors come in as a way of trying to manage those thoughts because they have no way of overcoming them by themselves.
Exactly. Yeah.
That's so interesting. I didn't realize actually how linked the thought and the compulsive behavior was. And OCD, I mean, that's obviously not a misunderstanding necessarily on my part, but just a lack of awareness exactly of this condition. But there are lots of misconceptions, misunderstandings that come with it. And what are some of the most common ones about OCD, perhaps particularly with children?
Well, the greatest misunderstanding is that many people think that people with OCD, they can just pull themselves together. Why don't you? I mean, if you know that the thoughts, as you just said, Claire, are absurd, and you know with your rational way of thinking that nothing will actually happen in real life if you don't do your compulsions, for instance, even if you have this insight into your symptoms and you can rationally make a distance to them, you are forced to you can't get rid of the thoughts, and you are forced to perform your rituals. And that's very hard for many people to understand, because if you have this insight into your thoughts, why don't you then just say, well, this is rubbish. I will not listen to my OCD. I will just have my own free will to do whatever I want to. And that's very difficult for people with OCD to be misunderstood in that way, because, and that's also, I think, one of the reasons that it used to be or still is, a very hidden disease. In which you try to, you don't inform everybody that you have OCD, and that may be due to the reaction that many people are met with from other people, that, well, you can just pull yourself together. And the other reason why it's often hidden is that the content of the thoughts could be very embarrassing. It could be thoughts about violence, about sex, etc., which are very difficult to deal with other people. So I think the greatest misunderstanding is why don't they just pull themselves together, and why or how can OCD have such an impact on their life?
Yeah, and that's what I'm really starting to get a sense of, the significant impact that this had. And you mentioned earlier the way in which that actually some behaviours are sort of a normal part of child development, that even we as adults might like to do things in a particular order, or almost have superstitions around certain things. But, you know, for parents, what are some of the early signs of OCD that you might notice at home? I'm guessing especially not just before a child has the adequate language to explain them, but as you said, they might know those thoughts, but they're embarrassing and they can't vocalize them. So what should we as parents be sort of looking out for? What are the signs we might notice?
So some of the early signs can be sometimes difficult to detect, because, as you say, we see this ritualistic behavior as a normal variation. So the key points are that the child is, if you have a suspicion that your child is very occupied by these rituals or thoughts, that it takes energy from other things. If the child is increasingly occupied by these things, and also involve parents in, for instance, in repeatedly asking whether they have done things correctly, or whether something can happen from this and this. So it's also it's a interpretation of this as more than normal, because many children, especially children who are a bit anxious, they ask for reassurance from the parents, and that's quite normal. But if you're afraid that your child is too much occupied by these thoughts or behaviors, and also tend to be impaired by it, that you can see it's anxious, and maybe it's a problem falling asleep. Maybe the child spends longer and longer periods in the bathroom because it washes its hands, is unable to eat with the family because of intrusive thoughts about the food being poisoned, or get more and more isolated from it. It depends on the child's age, of course, but that it's no longer part of the sports activities that it used to do, or is somewhat more afraid of going to kindergarten or school, and that when there's a change in behavior and emotions of the child, you have to be aware of what would that be.
Where that's coming from. And I'll come back to what you were saying there about some of the elements like reassurance seeking and things like that. But before we get into that, what kind of intrusive or obsessive thoughts and compulsive behaviors are most common in children and adolescents with OCD?
When I think it's important to say that you can see any kind of obsession and compulsion. And that's important also as a message, I think, because many children with OCD think they are the only child in the world that have these bizarre thoughts about something. So it's just your imagination that actually decides what kind of obsessions can be seen. But the most common ones are fear of dirt and contamination, that your child has obsessions that if he or she touches something, he will spread contamination, and some of his family members or teacher or whatever will be ill, or he or she will be ill himself. So spreading or having a disease is very common, and we can see it. It's those symptoms that we talk about now are seen in both children and adults, and they are quite the same actually when you look at different ages. And also, if you look in different countries and across different cultures, we see that the prevalence of certain obsessions are the same. So it seems as if it's something, biologically, and it's very common for all humans wherever they live to have these thoughts. So dirt and contamination is very common, and linked to that obsession is, of course, the cleaning rituals, that you have to wash your hands over and over again, or you have to take long baths, or you have to clean around yourself. I have had some children that had to wash hands up till more than 100 times per day, which is awful, usually with hot water, because that would kill the bacteria or the vira. But it's very damaging, of course, for your skin and for you to have these rituals. And often the parents will be involved. The mother will have to turn off and on the water, open the door, bring a towel, etc., because the child thinks he will be contaminated once he touches something which the OCD tells him is not quite clean. So fear of dirt and contamination, and fear that something terrible will happen to yourself or one of your family members, and it can be in your mind that if I don't do this and this, my mother will be a victim in a violent attack or in a traffic accident or something awful. So I have to do this ritualistic behavior, counting all the windows that I pass when I walk to school or whatever it might be. So, and fear of illness, fear of death, they are very common. But also what you call symmetrical obsessions and compulsions, which are those obsessions about everything has to be symmetrically placed. If you enter a room, things should be placed in a certain order. I must admit, I have some of this myself. Not that I'm impaired by it, but when I enter a large room, for instance, I always look up in the ceiling, and it disturbs me a bit if the lights or the lamps in the ceiling are not well placed symmetrically, and so I think it's quite an imbalance in the room. So I don't use many minutes on that, but I recognize it, and I try to reorder it in my mind. But children with OCD, they use a lot of energy in rearranging things, not physically perhaps, but in their mind, but also physically, that things has to be placed in a certain place in the room, for instance. Another common symptom is also what we call mental rituals. We have talked about obsessions as being thoughts that are in your mind, and then compulsions that you perform. But we also have compulsions that we just perform in our imagination or in our brain. They are not evident for other people, so they might not be recognized, but they can be just as time-consuming and disturbing as when you have to do something physically. It can be that you have to count to a certain number, you have to do some complicated math, you have to say all the names within your head of all the dear ones that should not die of some reason. So this is occupying your mind very much without that it's actually seen from the outside. So that can cause, and when we talk about ADHD, these symptoms can also cause a disturbed concentration, attention, because it occupies your mind.
Gosh, so interesting. I have got so many questions off of what you just said there. There was like lots of little points. I'm gonna keep coming back to them. You know, especially around the fears, around loved ones, I guess parental involvement, the whole ADHD element there. But I'll do them one by one so I don't bombard you with them. I guess the first thing is, how can we tell? Because, you know, we talked about some of those normal ritualistic behaviors that maybe we all have, or worries that are appropriate developmentally. So how can we tell that a child's fears, that overthinking, and you mentioned reassurance seeking earlier, are becoming part of an OCD cycle? So when do they become more than just, you know, I guess an age appropriate worry, even if we're seeing a repeat pattern of them?
Yeah, it of course, the number of symptoms at the time that it occupies in the child's life is very important, and the degree of which it disturbs the child. So the degree of impairment, how impaired is the child in its life? Is it very anxious and disturbed, and is it impairing or disturbing the quality of life of the child? Is very important. Does it cause in isolation that the child cannot function socially as it would have done and would like to, because of fear of contamination, or fear of being together with other people, because that would trigger the obsessions and the compulsions, and then leading to avoidant behavior, that the child will not perhaps go to school or participate in social activities, or allow parents to have strangers in the home, friends in the home, because then the child gets very afraid that they will bring something, bacteria or whatever, inside the house. So, but it's on a spectrum. It's not so that's what you have to judge when you say this is qualifying for an OCD diagnosis. You have to see, of course, see the character of the symptoms. How much do they occupy the child's daily life, and how impaired is the child in terms of quality of life and social life.
And that impairment, I mean, some children become very distressed by intrusive thoughts. And you touched on some of these, fears like someone getting hurt, something bad happening to someone in their family, death. I guess even bigger, kind of more existential worries. So how should we as parents kind of understand those thoughts? Like when our child, or we recognize that our children begin sharing them, what should we be doing?
How should you react as a parent when the child tells you about this? Being understanding, of course, and being accepting and talk openly with the child. So, because that's the first step in where the child also can make his or her thoughts less dramatic. That's the first step to have a sort of relief that you share your thoughts with your parents. So accept them, even if they are, they could be violent. Some children have pictures or thoughts that they would do harm to other people. For instance, their parents. They would tap. They would use a knife or whatever. It can be very frightening. And the child, of course, also can feel very embarrassed that he or she has these thoughts as part of OCD. So accept these thoughts and reckon them as part of OCD, not a real desire of your child that he or she will kill you, of course. So that's the first thing, and then try to have more information on how much do they occupy your child's mind during the day. What times of the day are the worst, and what consequences does it have for your child, to have a broader picture. And then, of course, support them and say that you thank you for sharing your thoughts, recognizing or also saying that this might be difficult for you. I can understand that, but I can, as a parent, I have the stamina. I can have. I dare to listen to all your thoughts, because. And also saying that this is not a condition that is seen for the first time. This could be part of OCD. So making it more, try to making it less dramatic in the first part. And then reassure your child that you will support it. So I don't know if I think we're going back to the treatment aspects of OCD, because later, am I right? Because
yes,
parents play a very important role in that, to be part of the treatment. And part of the treatment is, the first steps are, of course, to accept that the child has these thoughts and behaviors. And the next step is, how do parents support and help the children the best way? But maybe we can get back to that.
Absolutely. Let's definitely get on to the treatment element of it, because that's so important. And I think just what you said there as a first step about creating that safety, I guess, for a child to feel like they can share. And when they do share, that we meet that in a way that doesn't, I guess, exacerbate feelings of embarrassment or shame or anything else that it might, the fears that it triggers alongside it. But before we get into then the kind of treatment element of it, I wondered if we could have a look at the way in which OCD overlaps with ADHD as a coexisting condition. So, how do those two conditions overlap in children with ADHD and adolescents, and how common is the overlap with OCD?
Yeah, it is more common that we thought. I mean, just some years ago, some years ago, we think that based on what we know from studies on this, that 20 to 25% of people with OCD also meet the criteria for ADHD, and that's the frequency in children and adults that have ADHD of having OCD is also increased. It's a bit unknown how much to what degree, but we certainly see those conditions together. We also see an overlap, a common overlap or a common comorbid disorder that they have both conditions on the same time. And we also see a great overlap between OCD and Tourette's and tics. And sometimes it can be difficult in cases where you have both OCD and Tourette to tell what is actually part of the Tourette and what is part of the OCD.
Interesting.
But you see this overlap and between ADHD and OCD, and at first glance it can sound almost like the opposite of OCD, actually, of having ADHD, because in OCD you have this more rigid patterns of thoughts and the same thoughts that go back to your mind again and again, as we have talked about. And in ADHD, you have much more impulsive behavior, racing thoughts, and another sense of inner chaos. But actually, it can be combined in both children and adolescents. And in those cases, it can be really challenging and exhausting to have as a child to have both ADHD and OCD, because they can be, feel in some way torn between the two conditions.
Yeah, I think what you were saying there about the overlap in relation to thoughts was an interesting point, because I can see how that happens. If you have racing thoughts and a very busy brain, and as you were describing it earlier, within OCD, you have thoughts that rationally, are, highly improbable, let's say, and yet you then aren't able to manage those thoughts. I can see if those thoughts just get away with you from an ADHD perspective, they just keep going, don't they? Like a snowball is what I'm sort of envisaging in my mind, that they get bigger and bigger and bigger and bigger because the thoughts are moving so quickly.
Yeah.
And that's how I sort of imagined it as I was listening to you speak.
Yeah, exactly. You're right. I think that's a good visual picture of it. And how come then that they do overlap? I think, or we think, that in some cases the OCD might also be a consequent conditions or a subsequent condition of ADHD in order to try to manage the chaos in a quite overcompensating way, so to speak. That we know that people from ADHD, they can compensate in many ways, and in some ways these OCD patterns might actually be an expression of coping with the ADHD symptoms. So it might be linked in that way, but we also know that comorbidity, having more conditions and at one time, are in general very commonly seen. It's not just between OCD and ADHD, it's between ADHD and many other anxiety disorders, depression, etc. So OCD is one of them.
Yeah, and I was going to ask what then makes that combination difficult to recognize, because as you described, that perhaps it's a way of managing the chaos, and I'm by no means making light, as we said at the beginning of this, in terms of me from an OCD perspective, but I can recognize those traits in myself. I want a space that I'm in to be tidied and very particular, and you said balanced, symmetrical. because it's a way of helping me create sort of calm and peace visually when my brain is so busy and so chaotic and firing all the time. So, what can make the combination of ADHD and OCD, just from that particular comorbidity perspective, particularly difficult for parents to recognise?
I think it's very interesting and very clear what you say, that it might be a coping mechanism, but it might be more difficult to because I think in many cases OCD, as we've talked about, it can be a hidden disorder, and it can be even more hidden or masked by ADHD. Because ADHD, if in a child with ADHD, that's much more, or could be much more disturbing. Not that OCD is not, but ADHD is usually disturbing also to the parents, to the school system, etc. So the behavior in ADHD is much more overt than in OCD. So OCD, I think, might tend to be overlooked in children with ADHD much more than if they did not have ADHD. And they can be both. I mean, it could also be difficult for both parents and teachers and whoever are around to interpret the behavior, because it sometimes is the ADHD side that is the overwhelming side, or the things that are out in the open. And if you have to make something in school, for instance, the ADHD might cause problems in terms of keeping attention on what you should do. And that's one part of it. And the OCD might tell you that you have to do it in a certain way, you have to do it in a ritualistic way, or you have to check again and again that the things you have done are correct. So those are quite in opposition to one another, and may both to the child cause disturbance, but also make it more difficult for the surroundings to actually see what's going on, I think.
Yeah, it's a really good point, isn't it? That I guess with ADHD, particularly in a hyperactive presentation, that those behaviors are going to take precedent, aren't they? They're going to be the thing that's you can't ignore. It's very obvious, and it has such an impairment in, whether that's in school or at home. But then, as you say, some of these things are going on beneath the surface. How then, just to pick back up on your point about parents, family life in all of this, how does a child's OCD really impact family life as a whole?
It might be in very many ways that they impact the whole family. And usually the OCD is not only the child's own problem, but the whole family's problem, both parents and SIPs and so. And it can impact the family in many different ways. I mean, one way is when the child involves the parents in the OCD, so to speak. And it's very often that children involve parents. Adults with OCD tend to involve other people much less, but children tend to involve parents a lot. And it might be that they are actually drawn into the ritualistic behavior of the child, that they have to fit into the rituals in a certain way, doing certain things in a particular way, because the ritual has to be performed in a certain way. They can be kind of servants to the OCD, not the child, because it's not the child's own will. So I think it's important to tell what is OCD and what is the child's wish. But the OCD tends to also involve parents, that they have to help the child, bringing, as I said before, a clean towel, to open doors, to make sure that everything is clean, etc., etc., and also to answer on the child's repeating questions every day, which can take hours in some cases, to reassure the child that nothing is going to be wrong and it has done the things correctly during the day, etc., or reassuring that mom is not going to die, etc., what it might be. So parents tend to be involved a lot. They can also, as a family, be more isolated, because it might be difficult to go out, to have a social life, and also to bring friends to your home, because that could, in some cases, trigger your child's OCD. And most parents do not. It's awful to see your child having anxiety attacks. So it's really strong forces that you're against. It's really not that easy just to say to your child, no, we will ignore your OCD tonight, because it will hurt your sense of being a good parent, or hurt your feelings, and you think that, well, actually you could say, we will not see anybody tonight. We will get involved in your rituals, and then the child will calm down. So that's this accommodation to the symptoms is what many parents will naturally do in order to lower the level of anxiety in the child. And that's very understandable. But it's not the right way to do it, because it would just in a certain way confirm your child in its belief that, well, my anxious thoughts of this and this that can happen or go wrong is actually it's not so far out as my parents actually react to them in the way they do. So it's not the right way to do it, but it's very difficult not to respond in that way. And often also the whole family can be affected, because the child can have outbursts, or, as every child can, but this is mostly out of desperation and despair of the OCD. And then sleep problems, that it might be difficult for the child to go to bed, because there are so many rituals that should be performed before he or she can go to bed. And because many children with OCD, it's also a disorder of not being secure. Even if I have performed my rituals for an hour, I'm still not convinced that this is enough. There's always a bit of doubt. It's disorder of doubt, actually, that I have done things correctly. So sometimes I have to start over again. And it's whether I have to do something in my room, or whether I have to do something in my brain as a mental rituals, I have to start over and over again. So it means that it might be difficult to go to sleep, for instance. So there might be many ways that the whole family is affected. And also when it comes to not going to school, because OCD is also one of the reasons why some children cannot attend school.
I like what you said there about disorder of doubt. That made so much sense to me. You can really see how, obviously we know that there's intrusive thoughts, but that fear seems so deeply at the heart of many of these challenges. And then as a parent, naturally, we want to reassure our children and we want to do things to settle their fears. But it sounds like what you're saying there is that actually the challenge then is that we almost validate the fear by meeting it.
Yes.
Rather than that, we think we're helping them. We think we're reassuring them that everything's going to be okay. But because we respond to the thought and the behavior in that way, that it then validates it, which feeds it. Have I understood that correctly?
Exactly. Precisely. Yes.
So obviously, that's not something we would want to do in that scenario. I know that as parents, we unintentionally, we think we're doing the right thing, and often that's not the case. But how is the best way to respond to that? Because to pick up then what you were saying about the safety element of it being such a core feature, how do we respond to that in the first instance? What's the best thing to do so that you're not feeding it before you then start to move on to kind of us talking about treatments?
I think the first step in that connection is, as a parent, also to realize that this is an exaggeration of normal behavior. We have talked about the normal variation, that many children have these rituals, not to that degree, but on a lower level. And that's a normal reaction that everybody has, that we have to react to danger, we have to prepare for something that could be dangerous, etc. That's a part of our survival instincts. But in cases of OCD, this has gone far beyond what is actually rational and also necessary. So it's something in your mind that many of us have, but in cases of OCD, it's run out of control. So you have some thoughts that are coming back again and again, and are now sort of directing how you should live your life. And with that picture in your head, how can you help your child getting back in control? Because that's what it's all about, that the child try to externalize its OCD, saying it's not part of me, it's OCD as some kind of enemy or a monster or whatever picture you would like to have, that has, so to speak, attacked your mind. And how can we, parents and the child, defend that in the best possible way? And that is by, not getting involved, as we talked about before, in the rituals. It's the most helpful way to respond is to say, well, what can we do to change, or to make OCD less aggressive, and so that your own will is getting back? How can we help you as parents? And that's something also when you go to treatment, that is a very important part of the treatment. How can we support parents to be, apart from also parents, of course, caring parents, also be some kind of co-therapists at home? Because when you come to a psychologist or a doctor, you make a plan of how should we attack your OCD, in what way can we do it the best way. But the arena for this fight is actually mostly at home, where the symptoms are. So you have to be involved in that, and you have to also support parents in that they have to step back from getting involved. And that's very difficult, because then you will have a reaction, of course, in terms of anxious behavior. Maybe the child gets very furious. Why won't you help me anymore, Mom? Don't you love me anymore? All that kind of stuff. And then you have to rely on the alliances that you hopefully have made with the doctor, with the psychologist, that, as we talked about with the psychologist, the best way that we can do this is doing so and so. So the child and parents fight together against OCD, and it will not be a fight between the parents and the child. That's very important. So that's the first part, recognizing what OCD is and how to tackle it, and also with the parents as being very important in that.
It's very interesting what you're saying there, because it's recognizing, I guess, respecting how severe that fear is, but seeking to understand it with them and then get help to manage it the right way, rather than just feeding the fear unintentionally.
Exactly.
Obviously, we're all, as parents, just trying to make to help our children, to make them feel better, to reassure them, but actually that there's a really careful balance there, and it's acknowledging it, creating space that it's safe for them to share it, but then figuring out together through support and how we treat it and how we figure it out, rather than making it worse.
And you're quite right. It's a balance. It's not that you come home from the first consultation at the psychologist and say, I will not getting involved, as we agreed, so now you're on your own in that sense. It's a balance. And also when you come to the psychologist, the part of what has proven to be the best and the most evidence-based treatment for OCD is what we call the cognitive behavioral therapy, where you work with the cognition, the thoughts that the child has, but also, and very much, with the behavior, and doing what we call exposure and response prevention. Exposure meaning that you actually explain, or you decide that now you go home and you expose yourself to what you know would trigger your OCD, and then you try to react in another way. Instead of going out and wash your hands in a certain way for 15 minutes, you try to reduce that, let's say 10 minutes. So you have to do it very stepwise. You have to do it realistic, so the child can feel success in the treatment. So that's very important, because you have to be allied and to feel safe in the treatment, which can be actually very demanding for the child.
I was thinking that's really interesting as well, isn't it? Because if we think about bringing then ADHD into the picture there, where children often need much greater scaffolding and support to manage
Exactly.
these things. And as you said, you do it step by step. This is not an all or nothing. We're not kind of switching it off overnight, because it's for children with ADHD, it's so important for them to build evidence of their successes, to be able to have a belief in themselves that they can do this, or they can do it differently, or they know how to approach it. And as you were talking then, I can see how those two things would work hand in hand. They would need to be scaffolded. It would need to be a stepped approach, so that you build a sense of safety and trust in the process itself.
Yeah, you're quite right. And I think in children with both ADHD and OCD, as you say, have to be scaffolded even more, and they might need a more close consultation. Not that we'll see you next month and then we'll proceed. It's not very good. You have to be more concrete. You have to have a more frequent feedback where you are reinforced positively. Well, and you are well done. And even if it's not a large step, a minor step is well done, because it's the first way of trying to change the situation and trying to give the child the feeling that, well, there's something actually that I can do in order to get more in control. So that's the very important part of it.
Yeah.
And it's also important in terms of, well, cognitive behavioral therapy, that you learn strategies. And of course, it's easier for adolescents and adults than it is for small children, but that you learn some techniques and mechanisms that you can use when you feel that the OCD is coming back, which is sometimes does.
Yes, I guess it's not linear, is it, in that sense, that progress? You might feel like you're making progress and then suddenly take a kind of few steps back because something has triggered it. I really like what you were saying there, because often when we are perhaps exhausted as parents and supporting our children, and we can see the toll that it's taking, naturally we want a fix, and we want that quickly. And I think maybe it's human nature to want to jump to the end point, of what it looks like when it's all resolved, or the best it could be, without realizing that actually to get there, it's tiny incremental steps that reinforce it, so that if you do find that it flares up again, that may not be the best term, but that maybe that progress has halted somehow, that it's easy to sort of go back a couple of steps and build forward. Have I understood that correctly?
Yeah, you understood it completely correctly. Yeah.
So if a parent listening recognizes some of these signs in their child and realizing actually, maybe there is something more going on, they've got ADHD, those racing thoughts, perhaps there is a lot of intrusive thoughts there, or some of the behaviors that go alongside things are no longer ritualistic, they are perhaps verging into some more sort of obsessive-compulsive behaviors, what should their first step be?
Well, the first step should be that to as we talked about before, talk to the child and try to have a picture of how distressing is the condition and how time consuming is it, and is it something that we can manage on our own, or should we seek help? And I would advise that if your child is obviously disturbed by the OCD, you should seek help, because treatment is actually effective. We know that in terms of psychotherapy, but also in sometimes medication is effective. And this treatment can be combined with ADHD treatment, as we just talked about the psychotherapy. There are many similarities in what you actually do. You have to moderate the cognitive behavioral therapy if you have severe ADHD, of course. If medication is needed for OCD, it can also be combined with medication for ADHD if the child gets that. So seek help. And that's the best advice I can do. And then also try to find out with your child, because it's different from individual to individual. Who should know about how you're feeling? Would it help that the teacher in school knows about it? Would it help that your classmates know about it? And it can be very different depending on what types of symptoms you have. But it might be important that other people are informed, because then they understand the child better. Why can't he go out of the door before without counting to 15, or going forth and back? Or why is he taking so long to get finished with his things in school, etc.? So all that we have talked about lying behind this behavior could be helped if the teacher knew about it.
Yeah. So basically what you're saying is to create, as a first step, that open communication so that it's safe,
Yes.
not just in a home environment, so that it's understood and that it can be shared, and then that it's something you can work on together, but actually opening up that communication into other environments so that there's a level of understanding there for these challenges too. And that's your first point, really, like figuring out, if we talk about this, if we explore it together, if we can avoid feeding it, actually, maybe that's a question. By doing that, I'm not saying it's always the case, because as you said, it's about impairment, but is there the possibility that by actually creating that open conversation in the first instance, because you said at the beginning, the children often know these thoughts are not rational, but can you, by allowing them the space to share them and those be safely received, can you actually, in doing so, limit the likelihood or the impact of those becoming obsessive compulsive behaviors?
In some cases you can, because the first step is to be open about it, and also to make the thoughts less dramatic, and in that case also less impairing. Because you can talk with your child that, these thoughts, many children and adults for that sake have these thoughts. They are not rational. It's very unlikely that something of these thoughts should actually happen, etc. So by being open, that's the first step. It's not always enough, because as we've also talked about, OCD, it can be very severe, and it can be necessary to treat more professionally than just being open about it. But that's certainly the first step.
The first step. And then, as you say, if those behaviours are so severe, becoming distressing, or just that conversation, that open conversation just isn't enough, then to seek treatment and get that support to work on it together as a team.
Exactly.
So what final message would you leave parents listening to help them feel less alone on this ADHD journey if they recognise the symptoms you're describing of OCD?
Well, I think we have touched upon many very important issues, and also with some advice to the parents. But I think an important message is that OCD can be effectively treated. So it's worth getting help. It's worth being open about it, because OCD, if not treated, can in many cases be very disturbing and can have a lot of consequences for your child. But also recognizing that fighting against OCD is hard, to respect that and prepare for ups and downs that we have also talked about. And as a parent, support the treatment that your child is part of, it being both psychotherapy and the medication. And also, when we talk about the children having both ADHD and OCD, that those treatments for each condition can be combined.
Per, thank you so much for joining us today. I've learned so much, and as I said at the beginning, it's not something that I really knew a huge amount about, other than probably a lot of the stereotypes and the kind of top level stuff, and to really understand that picture, what OCD can look like, what's happening inside a child and adolescent brain when they're struggling in this ways, the overlap with ADHD, why that might happen, and actually what to do for the best for children has just been such an interesting conversation. And I've no doubt that you will have helped lots of people. So thank you for your time and for sharing your expertise with us today.
Thank you very much, Claire. Thank you for inviting me, and it has been a great pleasure. Thank you.
Thank you, Per.
If you'd like to learn more about today's episode, then please do check out our show notes below for more information. Or if you'd like to find out about how I can help support you and your children with personalised ADHD coaching, then please do head to allaboardadhd.com. You can also find me on Instagram and TikTok at allaboardadhd. Most importantly, if you enjoyed this episode and found it helpful, please can you follow and review All Aboard to help other parents find this podcast and welcome them aboard our journey too. Thank you for listening to All Aboard ADHD.